With an ever-growing population and more of us living longer, the challenge to keep us healthy has never been bigger.
Society is growing older and we're all living longer, and of course that will put a huge strain on health services that could affect the quality of them.
I think the NHS is really stretched.
Budget cuts and financial restrictions upon the NHS is a serious concern.
The workload for doctors is quite large. We have nearly 16,000 patients and we've got 10 doctors.
The demand on health and social care services is at an all-time high.
You're constantly working in an environment which seems to be stressful and understaffed, and that really impacts on the service.
You need to educate the patients how to access all the different ways in to the NHS.
No change is not an option, quite frankly, because the NHS cannot afford to do what it's doing now.
I like the fact that the staff really care.
I was in Queen's and I could not get better treatment.
If I go to my GP, it's a different one every time, but they all take the time to sort of listen, explain.
Despite the pressures, it's thanks to the dedication and hard work of the doctors, nurses, paramedics, social care, we are getting the care we need.
Professionals working in the health service, I feel they're all heroes.
I think patients are definitely aware of how focused we are on giving them care.
I love working for the NHS. It's dedication, and I work with people that really love it too. They all enjoy their job and they're dedicated and passionate about their roles.
It's a vocational career and we came into it because we all care, and that's why you stay a bit longer and that's why you stay for the birth that's carrying on.
We've got very dedicated people working very hard to deliver very high quality care, but ultimately it's about how we address the needs of our population.
Staff are going above and beyond to try and help their patients as much as possible. The issue for me is that we need the additional funding and we can't deal with the capacity that we have.
Change must be allowed to happen and things improve to protect the health and care services we value so much, not just for now, but for future generations.
Change, of course, is both an opportunity and a threat. People will feel, what if the service that I rely on changes in a way that I don't like?
The NHS has constantly had to adapt itself, and it must continue to do so, as the world and our health needs also change.
Essentially, we want to make sure that patients and families are at the centre of everything that we do.
I think the NHS is a constantly evolving institution, if you like. It needs to change and we need to evolve like everything else, but we need to stop this division between mental health and physical health.
It's why the NHS and councils in East London have come together to plan for the future and redesign local health and care services to benefit us all, now and in the years ahead.
It's a partnership of 20 organisations, hospital trusts, clinical commissioning groups and local authorities coming together to work with each other for the benefit of East London residents.
As the East London Health and Care Partnership, and backed by the leaders of all the organisations involved, they are combining their expertise and resources to develop ways in giving our nurses, doctors and care staff the best chances of success.
We're working hard to smooth out the pathways we've got between social care and the health service. We've got a vibrant partnership that works closely with the NHS through the GP network and on into the community services.
The partnership's mission is to protect vital services and to provide better treatment and care safely and conveniently closer to home.
We want to see better health services, better social care, and we can give greater support to our residents if we work with each other in a new and smarter way.
A top priority is to reduce the pressures on our hospitals and accident and emergency departments.
My dad was ill 3 weeks ago and we went to our local A&E, but there were people there genuinely with sticky eyes that they've had for 2 weeks. One had a cough with green mucus.
We know that some people attend A&E departments who have neither got an accident or it's an emergency.
We have a lot of people, they get home from work, they see that their children are unwell, and instead of coming to A&E, where else can they go to?
Making sure that we have good systems of discharging patients from hospital in order that they can actually be back at home and supported by community services as quickly as possible.
The partnership also wants better outcomes for cancer patients, reductions in diabetes and improved mental health services.
What has traditionally been really difficult is to shift resources, particularly into preventative care, and also intervening earlier in somebody's disease process.
We've got good examples of success. These what we call high-risk patients, we discuss them on a regular basis and put in remedial measures to prevent the sort of same problem arising again where it's possible to do so.
Classic example is when somebody's got poorly controlled diabetes. Quite often what somebody might end up with then is their kidneys fail, they end up on dialysis, kidney transplant. Most of those people we could stop if we intervene much more strongly earlier on. Much better outcome for them. And guess what? It's much cheaper for the system.
The East London Health and Care Partnership isn't afraid to tackle these challenges. It will build on the successes achieved so far and bring health and social care providers closer together than ever before.
What I think our challenge is, and what we've got to get right, is the front line level, so social workers working closely with health workers.
We're looking at how can we work together with social care colleagues to improve someone's well-being, link them in with other services such as voluntary groups, etc.
The partnership is not there to undo what works. Instead, it will drive forward new ideas and better ways of working that can put a stop to duplication and unnecessary expense.
To actually really work with the public about what do you need us to do and what are the things we can help you to do yourselves. It's a really important thing for us to get right, particularly here in East London. We need to make sure that we're investing in mental health services, social care, public health initiatives.
So I think there's great opportunities when you're under this sort of pressure and challenge actually to get through some really good new ideas and transform the service.
The NHS is now, they're advising patients to come in to speak to the pharmacist first. We offer a lot of services here as well, a lot of time with GPs. There's a longer waiting list now as well.
But the biggest single factor in the long term is to prevent illness, something that we can all play a part in. Everyone working and living in East London. It's not just down to the authorities.
We will only have an NHS if people look after it and do the right things and not abuse it.
I think collectively everyone needs to work together.
The problem is that a lot of people just go maybe to the doctor without having a real issue, or maybe go to the wrong doctor.
A lot of people don't turn up for appointments, which is like waste of money, waste of time, and obviously it impacts on the waiting time for other people.
One of our biggest drivers for the STP work is about self-care, and so it's important that we give people the tools to be able to do that.
The online patient access it's a marvel. It actually changes the way you use the NHS.
We've got to create the same revolution that the banks did, which was very cleverly to get you to do the work, but actually made it much more convenient for you because then you could do the transactions when it was convenient for you, often in the middle of the night if need be.
One of the biggest threats I see to the NHS is that they are trying to transform their services at the moment, but they're not transforming the patients as well. I think patients need to really play their part. So I think they have a duty, one, to know their health and to self-care, and one, to make sure they're fit.
It's up to us to enjoy life to the full by doing those little things each day that help us stay healthy and fit.
Getting their weight down to a reasonable level, taking a lot more exercise, giving up smoking, keeping alcohol to a reasonable level.
If we do this, and get behind the work of the East London Health and Care Partnership, the prize is that we are able to lead happy, healthy lives and get care we can rely on when we need it. To win that prize is down to us all.